Hey guys, I just got back from a much needed vacation from Arizona. Came at the right time because I was feeling pretty down in the dumps. Uh, certain, some of it was certain factors that were going on that kind of left me feeling that way, and other it was just, I don't know where it's coming from. So we had this trip planned a while ago and came at the perfect timing. So we went there. It was great. Went hiking, and I just felt like a free spirit out there hiking. And, I have probably mentioned this, but in my mid-20s, I developed a weird fear of heights where I've never been afraid of heights. So this was an accomplishment for me to do that. And I also am afraid to fly, and I'm not afraid to fly anymore. So plus for me. So I got much needed sun that I needed because I call myself a lizard, like I require heat and sun. So it just came at like the best time. So, and our friends there are wonderful, and we had a great time. And it's so weird, like for the first time I really didn't need sleep medication to fall asleep, and it's probably because I was sun drained. So I would love to move there, but it's not in the bags. And I know that there's that saying, like, a lot of people move to escape their problems, but their problems come with them. My case is different. I'm not escaping my problems. Like, if I moved out there, it's because it has things that nourish me. Sun, hiking, and I'm not talking like where I'm at, like where you can take nature walks. I'm talking like hiking where you feel accomplished, that you got so far, and it's just like looking at these mountains and cactus and stuff. So a funny story though, my husband, we were getting ready to take a picture, and he stood by like this random, like this weird cactus or whatever. Anyways, if you touch it, it automatically comes off and attaches to you. So it's like this big thing. It was on his butt. It really did make my day. It was funny. So, but it was good. I was very happy there. So came back happy to get my babies back on Monday. Kind of relaxed, and today it snowed, although I don't see any snow out there, but there are certain areas like maybe south or north of us that got like close to 5 inches of snow. So it's just not right in April to be having this snow stuff. So so anyways, as much as I would like to live in Arizona, it's just not in the bag. So it's a great place to visit when we need to reset, and we will for sure retire there. So our goal here is to find a house for dogs to play around. So anyways, the I'm trying to stop saying that word anyways. I can't stand it and I say it all the time. And anyways, so it drives me nuts and I do it all the time. The point of this video is to talk about mental health per usual. So I have noticed, and this is from myself, that like I had some weird notion, even though I knew the truth. And this is kind of cognitive behavioral therapy here for you in a weird way. I had expectations on this side that after my first year, I would be like full steam ahead, happy as like can be. And then the rational side is no, it's not possible. It just isn't. So I had this false hope that like, oh, after 1 year, like I'm gonna be great. And the reality is it's not true. And am I better than I was within the first year? Yes. Major difference. Major difference. So that's something to applaud. But I have spoke about like 7 stages of grief several times, and it never leaves you. So you're just gonna circle through, and you just never know when it's gonna hit you. Like it could hit you at any moment. So that's when you need to start building up tools, so that way when it does hit, you know what to do. So I have suggestions, and you can take it or not. I'm gonna start doing this myself, but I will do my disclaimer that I am not a mental health professional. And if you are feeling a very bad way, please seek out a psychiatrist, psychologist, licensed therapist, call your primary doctor, pretty much a medical professional. That's your first step. So for me, I do see professionals to help me get through some things. So, but there's some things that I've just kind of learned on my own, and this is my suggestion. So, when you are having days you kind of feel like, what happened? Like, what was the source of this? And was it really that bad? Like, was it that bad to flip me to the dark side of emotions? So I suggest getting a big old book or like journal, and basically draw a line and mark it 1 through 10. So 10 means that you are really at an all-time low, and 1 means kind of having an off day. So circle like the number where you feel like you need to reach out to a professional, that this was really bad, and keep track of it. And underneath that, write down like exactly what happened in the day. Did you do anything to try to help yourself get out of that mood? So basically, you are pretty much analyzing your moods. And I think that is pretty helpful, because then you're able to kind of pinpoint, that there's some kind of common factor. And if you can figure it out, is it something that you can remove out of your life? That way that doesn't happen. Or if it isn't, is it something that you can work with a healthcare professional to manage when you get to that high number? So this is just taking inventory on your emotions and, how often is it happening, and, what is going on, and how long did it last? Did you snap out of it? So, and like I said, what things did you do to try to snap out of it, if you did, and did it work? So, these are just kind of, it's helpful. Like I said, I'm very analytical, so I have to, my work, I have to, for me, like, I have to think, like, is this like a one-off? Is this happening like constantly? Like, if this is done, is it gonna just address that one particular issue, or is it gonna be widespread, and what are risk factors, and so on and so forth? So I'm kind of trying to take the same approach to my mental health as I would in my job. And so this is something that I'm going to start, because I have not done this. So I am going to I'm just going to label it a mood book. So every day I'm going to rate my scale. I'm going to have 2 lines. One will be anxiety, and the next one will be depression. So I'm going to rate those, and then I will have down anxiety, what triggered the anxiety, depression, what caused the depression. And sometimes you don't even know, so you can just put unknown. Sometimes you just wake up feeling, not yourself, so unknown. So, and then underneath those boxes, was there anything that you did? And then, did that help? And soon you'll realize, what is helping you, what is not helping you. So, and then towards the back of the book, like, kind of put a tab, anxiety and depression, and write down everything, techniques that help, or that you feel help you, for anxiety and depression. So that way, that can be like kind of your go-to source. So if you're feeling anxiety, go back to that and be like, okay, so this is like, let me try this out. So it's just kind of just like a mood book. It's just keeping track of things and trying to weed things out to be as manageable as possible on your mood, and how to deal with it. So when we go through these type of situations, it can leave us pretty defeated, so and helpless. and that's just not the right path to go down. So that's why I really encourage you to journal those. That way you feel that you do have control, because you're keeping inventory, and you're rating your mood, and you know when you need to seek help, and you know that you have resources that you have written in the back of what to do, and if it helped or not, find something new. And that gives you power back. So, and I would say the best analogy that I can give, and I believe I've given this analogy before, is that our emotions are a brand new balloon out of a bag, and it's completely deflated. So as we let anxiety and depression, or things that make us angry or whatever, that balloon, you're blowing air into it. You don't want it to get to the point where it pops. You know that air is going to get filled into it. So you want to get to the point where you know how to slowly deflate it back so it's not rupturing. So that's kind of the point of doing these things, is emotions are a balloon, and you don't want it to burst. You want to get to a point where you know methods to slowly deflate the balloon. So finding different techniques, and whatever, even like things that like distractions or something, anything you can do that helps is good. If you need to talk it out and you don't have access to someone immediately, have a safe person to talk to. Find a safe person that you can let everything out, but then call your professional and try to get in. So find that safe person that you can talk to. So I'm very lucky that I have safe people that I can talk to about how I'm feeling, but also like I have no shame in mental health, so I'm very open book. So it's just so taboo, and I just don't get it, because it is just such a huge factor in every single day life. And if you say you are like happy 100% of the time, you're lying, or you're on some kind of illegal drug. I don't know, one or the other. So, or something, I don't know, but things happen, and that affects our emotions. So that's called being human. So I really suggest trying that method out. I'm gonna try it for about like a month to see how it's going, and then I'll get back and let you guys know how it's going. I'm not gonna stop. I'm just gonna give a report on how it's going. And doing that on top of working with mental health professionals that I have in my back pocket have been helpful. So, and I am learning not to beat myself up when I do have an emotion. You don't want to suppress it to where you're like a robot and you're just kind of numb. That's not life. Numbing. So you just want to get to a happy medium where you're feeling your emotions, but you have ways to get through it. So I noticed, I go back through because I'm trying to rebuild my website some. And I was looking and I was like, in the beginning of my stroke, I blogged almost weekly. And, basically it was like, as I'm feeling this, I'm letting it out, but it was also to help my working memory, like to keep going. And, some of it, like I wrote in the hospital, but I didn't have a blog, but, I posted it in my blog later. I noticed towards the beginning stages, I blogged almost every week. And then, like, midway through the year, I would say, kind of died down. And then, towards the end of, like, or getting closer to the year, it just was maybe here and there. So, which is good. That means, I'm making progress. Things are getting better. Is problem solved? No. So I still plan on blogging, but I'm more gonna blog, basically if something strikes me, not just to blog every week. But I am trying to think of ways of trying to get people involved to talk about, their what's going on. And I was thinking, would anyone be interested in Zoom meetings, and it's just kind of like there's no topic, it's just we talk and like let it out, and you don't even have to show your face, because I know that there's some people that they just kind of don't want to show their face, don't want to be identified, don't have to be, come up with a name, an avatar, something, I don't know. Because a lot of these stroke support groups, which are great, great as in I've read about them, I've yet to attend any because they've been canceled due to COVID. I do believe they are doing some Zoom meetings, kind of like I'm suggesting, but again, they kind of choose the topic, and that's pretty much what you talk about, and they don't happen often, and so sometimes those topics don't fit what you're feeling, so it's like, well, I guess I'll skip that one. But I really would like group support. So that's just something I was thinking about doing. So pretty much, everyone can talk about whatever they want to talk about. So the or even like a chat wall or something, kind of like kind of where we can talk in privacy, where we're not like on Facebook talking to a group or whatever, or Instagram. It's just kind of private, where we're on a chat board and talking with each other. Because I feel like everyone's got something that they can bring to the table that's really helpful. So I'm still gonna blog. I'm trying to figure out like different like angles of making my website more beneficial. So the next step is I am going to lobby aftercare information for stroke, ruptured aneurysm survivors, at a state level, and then hopefully take it to DC. The B Foundation's doing a great job. They are fighting for funding for ruptured aneurysms, which is good because it is just so annoying to hear these stories. And they really touched on it, that like a lot of people pass away because these ER physicians, when you come in, they either A, think you're drug seeking, B, treat it like a migraine. By the time they finally get you down and get a CT scan, a lot of damage has been done. So, or you may not make it. So, and that's what they were doing with me. I was lucky that, like I said, I fought like hell. I was like, you give me the CT scan. And I'm still angry, and I know I need to get over it, but I will one day. But I'm still holding on to this anger that when you say and go into the ER and you're lucky to even be responsive at this point, a rubber band snapped, check. Projectile vomiting, check. Neck pain, check. As a physician, I would know. CT scan, this could be a possible ruptured aneurysm. But no, I had to fight. Because I have a history of migraines. So, anyways, that's what they're doing. But mine is different, that I want an aftercare, and it's basically for mental health. And a lot of cancer patients get the aftercare plan of emotions that you go through. And I don't know how every state is, or hospital is, on if they do give you information about like emotions that you can go through for recovery. I am very satisfied with the hospital that I was at after my emergency room, when they transported me to downtown hospital that has a very good neuroscience institute. And I had the best neurosurgeon ever, and sadly she's leaving for DC. So anyways, when you're discharged, what they do is they give you a booklet, and it's facts about the stroke. So, and it's really great information, but they kind of go over like a glossary of like terminology, which is kind of helpful, especially if you're talking to other people, because people have different things, so it kind of helps you understand. Just like procedures. I had a clipping, so that was a full craniotomy, and they clipped my vessel. And it's an invasive surgery because they cut, and you can see the mark where they go, and it went all the way down here and down, and so I have an indent like all the way from them doing that. So clipping procedure, where coil is less invasive, but that's placed to stabilize it. But there's a lot of different stuff that kind of helps you understand. So then they go into stroke risk factors. And and they talk about fast. Which is helpful. I don't think fast really applied to what I went through. So they need to add that section and other symptoms, because none of these applied. But and then they go into you know, different types of strokes, and then they go into graphs, and you know, between ischemic and hemorrhagic, and you know, point out the differences, and how common is it, you know, treatment methods, what's the follow-up, and then they have testing that you will have done. What tests are done to diagnose a stroke? Well, number one, CT scan. They don't really do that. MRI, MRA. So they go into tests to figure it out, and then they go into like your treatment plans, and then they go into what are the effects of a stroke, and so this is more like, it's weird to me because mine was left-sided, and it says may cause inability to move the right side of the body. I didn't have that issue. Left half of the brain controls speech, language abilities. I didn't have that problem. Some may run into memory problems, like difficulty in understanding and or learning new information. I have short-term memory, but I don't have, I learn very quick. So I think I'm very lucky on this. But it's an eye-opener for me to understand what other people are experiencing. So they do have a small section about what to expect after your stroke. And so they basically say what I say. It continues throughout life, not a couple of months. It is a lifelong event. It will be a challenge for the survivor and loved ones. It's important for family members to understand those emotions, you know, to feel like you can help. They do say fear. You know, it's normal that people fear that it will happen again, that you may not accept your disabilities, might be put in a nursing home. Friends or family may not be supportive. Survivors might be unwilling to take medications and may not want to do mobility exercises. That's under depression. This behavior might discourage friends or family members from helping. memory loss. I don't really get into that. That's it, folks. That's it on emotion. That is all they have in there. So underneath their depression section, I would figure this would be a huge like area. That's how short it is. I figured there would be a lot more to it. And it's basically like it's amazing to me. So the other point, I just noticed they have a nutrition section in here. Foods which reduce your risk of stroke. I never saw this before. Mediterranean diet, which is great. I don't like meat. I feel like this might be more for ischemic. Than what I had. So I feel like it's more cardiovascular. So they give you like, you know, some foods, sodium free. Again, I think it's more ischemic stroke. Self-management. They go into, I feel like it's more like for family, like this book was made for your caregiver, because it says that it goes into learning CPR. You're not going to do CPR on yourself, so obviously that's for a caregiver. Escape routes from the caregiver's home. How to call for emergency help. I did do this. We did set up an alert system throughout the house for me to hit a button. However, after the year, we did return everything back because my husband and I are both full, you know, at home full-time working. So I've got my husband, although he's very sick today. And then it talks about adult daycare. I'm sure that helps for other people that are in like severe, and that's actually kind of nice that they do have adult daycare.